Okay, so let's talk about aspirin. Now, everybody knows that aspirin can help save your life during a heart attack. How does it actually do this? What's going on? Why is aspirin so beneficial? Well, to understand this, we have to look inside the coronary artery. Now, what's happening is plaque has built up inside the coronary vessel, and it's causing the coronary vessel to get more narrow and restricting some blood flow through there. Fine. So the culprit is that plaque rupturing inside the coronary vessel. That plaque ruptures, it tears part of the inside of the vessel, which causes bleeding. That bleeding sets off a whole cascade of events to form a clot. And the first thing that happens during clot formation is that platelets clump together. Aspirin prevents those platelets from clumping together. So that is how aspirin helps save your life during a heart attack. Okay, so contraindications and precautions with aspirin. 1, are they actively bleeding? Do they have like an active peptic ulcer, something like that? Hypersensitivity or allergies to aspirin. So you ask the patient, hey, are you allergic to aspirin? And the patient says, yes, I'm allergic to aspirin. So you're thinking, I don't want to give aspirin. Anytime a patient tells me they're allergic to anything, I ask them specifically what happens when they take that drug. So what happens when you take the aspirin? It upsets my stomach. Do you ever develop a rash, hives, trouble breathing, sudden death, anything like that? Nope, it just upsets my stomach. Not a true allergy. That's a side effect of the drug. We can still administer the aspirin. So the patient may not really know the difference between the side effect of the drug or an allergy. So all allergies, ask specifically what happens to that patient. Okay, so dosing for the aspirin. First, what kind of aspirin you're going to use. And we need to use a non-enteric-coated aspirin. Remember, our patient said they had an allergy. It caused stomach upset. Well, manufacturers of aspirin coat the aspirin with a covering so that it's released slower into the body, and it helps to minimize that gastric upset. We don't want that. We want the aspirin getting into the system quickly so that it helps prevent those platelets from clumping together and making coronary circulation worse. So we're going to use baby aspirin, and you're going to instruct the patient to chew the aspirin up. Remember, some drugs are administered sublingually, like nitro spray. The reason is under your tongue it's very vascular, and that's a great point of entry for drugs. Don't believe me? After you watch this, go to a mirror, open your mouth, lift up your tongue, and you're going to see a whole plethora of vessels underneath your tongue. That's why we had the patient chew maybe 324, 325 milligrams of aspirin, had them chew it up so it gets under the tongue and absorbed quicker into the body. Now, if for any reason the patient cannot take the aspirin orally, you can administer a suppository. 300 milligrams intrarectal suppository will work just fine, and it's absorbed fairly quickly through the anal mucosa. Very vascular area. Don't believe me? Ever had a hemorrhoid? It's a vascular area. I'm Mark. Thanks for watching. We'll see you in the next video.